carbohydrate word means saccharide. So carbohydrates are also known as saccharides. So based on the number of carbohydrate units, we can classify the carbohydrates into monocarbohydrate, that is the monosaccharide. Monosaccharide. Saccharide word means carbohydrate. So monosaccharide is the one which contains only one carbohydrate unit. Mono word means one, di means two, saccharide word means carbohydrate. So based on the number of carbohydrate units, monosaccharide means it contains one carbohydrate unit. Disaccharide is the one that contains two carbohydrate unit. Oligo word means few, so it contains 3 to 10 carbohydrate units. And polysaccharide, poly words means many, so it contains more than 10 carbohydrate unit, that is a polysaccharide. Now talking about one by one each of the saccharides. Coming to monosaccharide, mono means one, that contains only one carbohydrate unit. So based on the number of carbohydrate, either the functional group is aldehyde or a ketone. 3 carbon, that is the aldehyde, is glyceraldehyde. Functional unit, if it is ketone, that is dihydroxyacetone. If the carbohydrates, number of carbohydrates are 3. If the number of carbohydrates are 4, then the aldehyde is arthrose and ketone is erythrulose. If the carbons are 5, then the aldehyde is ribose and the ketone functional group is ribulose. If it is 6, then glucose, galactose or mannose, that is if the functional is carboaldehyde, and if the functional unit is ketone, it is fructose. So remember this, we have already covered that if it is a 6 carbon compound, then the aldehyde, if it is a aldehyde, then it is glucose, galactose or mannose. Or if it is a 6 carbon compound and the functional group is ketone, then it is fructose. Now, if the carbon atom are 7, then glucoheptulose for aldehyde and pseudoheptulose for ketone group. 8 carbon compound does not exist in the nature in aldehyde as well as in the ketone group, and 9 is salicylic acid, which is also known as NANA, which is a modified sugar, N-acetyl-nuramic acid, and 9 carbon ketone does not exist in the nature. So reactions to monosaccharide, oxidation forms acid and reduction of a monosaccharide forms alcohol. So let's discuss the reactions of monosaccharide. As I already told you, oxidation of a monosaccharide forms the acid. So if oxidation occurs at C1, that it forms aldonic acid. I told you oxidation forms what? Oxidation forms acid. So if the oxidation of a monosaccharide occurs at C1 carbon atom, it forms a aldonic acid, and the example can be gluconic acid. If the oxidation occurs at carbon atom 6, then it is uronic acid, and uronic acid we'll be talking about in glycosamine glycan. So glycosamine glycan is a heteropolysaccharide which contains uronic acid as well as amino sugar. So glycosamine glycan, which is a heteropolysaccharide, it is formed by the tandem units, that is repeated units of uronic acid and amino sugar. So uronic acid here, the oxidation of a monosaccharide at carbon atom 6 forms the uronic acid, and one such example can be glucouronic acid. If the oxidation occurs at carbon atom 1 and 6 both, then it forms the saccharic acid, and for example from glucose it can form the glucosaccharic acid. If you see uronic acid structure, I already told you uronic acid occurs when the oxidation occurs at carbon atom 6. So oxidation forms acid, oxidation and reduction of a monosaccharide form alcohol. So uronic acid, wherein the oxidation occurs at carbon atom number 6. If you see the structure of a uronic acid, at the first carbon atom, this carbon atom is attached to only one carbon atom, therefore it is known as a primary carbon. If you look at the carbon atom 6, it is attached to 2 carbons, therefore it is known as a secondary carbon. If you look at carbon atom number 7, then it is combined or it is attached to 3 carbons, that is why it is known as a tertiary carbon. So if a carbon is attached to 1 carbon, it is known as a primary carbon. If a carbon is attached to 2 carbon, it is known as secondary, as the name suggests, and if a carbon is attached to 3 carbons, it is known as a tertiary carbon. Now if you look at the end structure of a glucose, this is carbon atom 4, 5 and 6. At carbon atom 6, C6 of glucose is a primary alcohol, as it has only 1 carbon atom attached to it. So reactions to monosaccharide, we have covered the oxidation. Oxidation forms acid. Now coming to reduction of a monosaccharide, that forms the alcohol. So it is hygroscopic in nature, that means it absorbs water. If it absorbs water, it will swell up. So cell causes swelling after the absorption of the water, that is because of the hygroscopic nature. Now monosaccharide, the reduction product, if you see glucose, which is a 6 carbon atom, if the reduction happens for glucose, it forms the sorbitol or polyols. So all is a word that is used for alcohol, and accumulation of sorbitol causes snowflake cataract in the diabetes individual. Now again a 6 carbon atom monosaccharide, that is a galactose, and reduction of the galactose can produce galactitol. Ol again is a alcohol. So we know reduction of a monosaccharide forms alcohol, oxidation of a monosaccharide forms acid. So galactose reduction produces alcohol, that is galactitol, and accumulation of dulcitol or galactitol, and it can cause the oil dropped cataract in galactosemia patient. Mannose, the reduction product is mannitol, and it is the drug of choice for reduced intracranial tension. All monosaccharides, they contain a functional group that is free, and therefore all monosaccharides are reducing sugar. Very important point. All the monosaccharides, they are reducing sugar because the functional group is free, that is why they can be reduced. So all the monosaccharides are reducing sugars. Very important point, asked in Viva again and again. So all monosaccharides are reducing sugar. The reason behind is the functional group is free in monosaccharides. Coming to disaccharide. Di means word 2, so they contains 2 carbohydrate units. One carbohydrate unit is this one, which is a monosaccharide. Another one carbohydrate is a monosaccharide. Again, 2 carbohydrate units are joined or bound by the glycosidic bond. So if you see examples of disaccharides, maltose, which is formed by 2 monosaccharides, which is glucose and glucose. So glucose and glucose, when they are joined by alpha 1,4 glycosidic bond, it forms a maltose structure. Now remember this point, when I say 1,4 bond, 1,4 bond forms the linear chain, and whenever branching occurs, it is at 1,6. So alpha 1,6 is for branching points. So glucose alpha 1,4 bond, it forms the maltose structure, and isomaltose is again glucose, but these glucose are bound by alpha 1,6 glycosidic bond, and both are reducing sugar, maltose and isomaltose. Trehalose is again glucose and glucose, but here the bond is alpha 1,1 glycosidic bond. Sucrose is glucose plus fructose, and fructose, now the functional group is ketone for fructose. Till here we have all the aldehyde functional group, glucose aldehyde. Now the fructose is a ketone functional group. So glucose and fructose by alpha 1,2 glycosidic bond form sucrose, and trehalose and sucrose both are non-reducing sugar. Lactose is formed by galactose and glucose, and they are formed by beta 1,4 glycosidic bond, and lactose is also a reducing sugar. So the test for the carbohydrates, Molesh test is a general test that is given for all the carbohydrates, and if the carbohydrate number are more than or equal to 5, then the Molesh test comes positive. Benedict test, very important test which is given by reducing sugar. We have already covered all the monosaccharides are reducing sugar, so all the monosaccharides give a positive Benedict test. So Benedict test is positive for all the reducing sugars. Selivanov test distinguish between the functional group, that is the keto group, and the aldehyde group, and Selivanov test is positive for the keto sugar. Now Barford test, it is positive for monosaccharide, and therefore it distinguishes between a monosaccharide and a disaccharide. Another important test which is routinely done for the measurement of the blood glucose is Godpod test. So GO is glucose oxidase and PO is peroxidase. So glucose oxidase peroxidase test, as the name suggests, it is an enzymatic test, and it is routinely done. It is an accurate test that measures the blood glucose. So what happens? Glucose in presence of glucose oxidase enzyme, it forms a gluconic acid. So we know that oxidation of a monosaccharide causes acid, reduction of a monosaccharide causes alcohol. So if you oxidize glucose, it forms gluconic acid plus hydrogen peroxide. Now in the presence of peroxidase enzyme, that is POD, peroxidase enzyme, it forms a colored compound, and we can measure the blood glucose from this colorimetry. So that is why it is used for measuring the blood glucose. Now coming to polysaccharide, as the name suggests, it contains many carbohydrate units. Polysaccharide, if it is made up of same carbohydrate unit, it is known as a homopolysaccharide. And if it is made up of different carbohydrate unit, it is known as heteropolysaccharide, as the name suggests. Homo means same, hetero means different. So homopolysaccharide means it is made up of same carbohydrate unit and mostly it is branched. While on the other hand, heteropolysaccharide, which is made up of different carbohydrate unit, it is unbranched. Unbranched means it is linear. Mostly the heteropolysaccharides are linear. Examples for homopolysaccharides can be starch, glycogen, dextran, cellulose, inulin or chitin. And examples for heteropolysaccharide is glycosamine glycan, which is also known as mucopolysaccharides. So glycosamine glycan, which is made up of uronic acid, which we have already covered. So when you oxidation of a monosaccharide, it forms the oxidation of a monosaccharide forms the acids, and reduction of a monosaccharide causes the alcohol. That means it forms the alcohol. So oxidation of a monosaccharide forms the acid, and one such example is uronic acid, and uronic acid and amino sugar forms the glycosamine glycan. So basically glycosamine glycan is a combination of this repeated chain of uronic acid and amino sugar, and it is a heteropolysaccharide. So glycosamine glycan is also known as mucopolysaccharides. Now talking about homopolysaccharide. Homopolysaccharide, the first one is starch. So storage form in the plants is starch. It is less branched, and branching point in a starch structure comes after 24 to 30 glucose. So after 30 glucose units, one branching point comes. And in glycogen, if you see, after 8 to 12 glucose unit, there is a branching point that comes. So that means glycogen is more branched compared to the starch. So starch, because the branching point comes after 24 to 30 glucose unit, that is why it is less branched compared to the glycogen. So starch is made up of amylose, which is 20%, and amylopectin, which is 80%. Now amylose is mostly unbranched, and amylase is the one that forms a 1,4 alpha 1,4 bond. Now alpha 1,4 is the straight one, linear one. When the branching point comes, it is alpha 1,6 bonding, that you have to remember. So amylase is the one that lies this alpha 1,4 glycosidic bond. Then coming to glycogen, which is present in the animals in liver and muscle, mostly it is branched, and branching point comes after 8 to 12 glucose residues. What is the similarity between starch and glycogen? It is made up of alpha glucose. So it has alpha 1,4 glycosidic bond in the linear, that is in the straight chain. And at the branching point, suppose this is the branching point. So here at the branching point, it is alpha 1,6 glycosidic bond. From where the point at which the branching starts, it is alpha 1,6 bond, and in the linear chain it is alpha 1,4 bond, that you have to remember. So digestion of a homopolysaccharide, that is starch, if you see taken in the diet, the digestion starts in the saliva itself. Saliva has salivary amylase enzyme. So amylase breaks the linear chain, that is alpha 1,4 glycosidic bond. This we have already covered. And limidextrins is the product that is formed. Isomaltase or isomaltose, if you remember isomaltose, it is formed by alpha 1,6 bond. So alpha 1,6 is the branching point, so it breaks the branching point. Then forms the maltose and maltase enzyme, again which breaks the alpha 1,4 bond, and it forms the glucose, which is absorbed in the intestine. So you can see here how the homopolysaccharide, that is the starch, it forms glucose, which is a monopolysaccharide. So polysaccharides, the homopolysaccharide is broken down to a monosaccharide. So multiple carbohydrate unit are digested to single carbohydrate unit. Now coming to the third homopolysaccharide, that is dextran. It is made up of alpha glucose. We have alpha 1,4 bond, alpha 1,6 bond, alpha 1,2 bond, and alpha 1,3 bonds in dextran. It is a highly molecular weight structure and highly branched structure. Now dextran is used as a plasma volume expander in case of hypovolumic shock. In case if an individual had a road traffic accident, there is a lot of blood loss, and because of this blood loss, patient has undergone into a shock condition in which you need to increase the volume of the blood. In that case, you give IV dextran to increase the volume of the plasma. So it is a plasma volume expander that expands the plasma volume in the blood, wherein there is a lot of blood loss. That is, in case of hypo means less, volumic means volume, in which there is less volume of the blood left in the body. In case of a shock condition, IV dextran is given to increase the blood volume. That is given as a plasma volume expander. This we have covered in the general surgery also. So in gel filtration chromatography, the gel which is used is again dextran, and in dental plaques and perio we have covered. Dental plaques are the network of dextran. So these are the things wherein we study dextran, which is a homopolysaccharide. Now coming to the next one, that is cellulose. Cellulose is an unbranched and it is made up of beta glucose. Now till now we have covered alpha glucose. Beta is the one. Beta bonds are not easily broken in the body because the enzymes are not present in the body. So cellulose is not broken down in the body, and that is because of the beta anomerism. Now anomerism is the one in which we talk about the functional group. We have already covered this. So functional group at C1. Now if you remember, functional group in the glucose is aldehyde, which is present at the C1 group. So cellulose is not broken because of the beta anomerism that is present at the C1, because it is glucose. Glucose is the one which contains aldehyde group at C1, so beta anomerism at C1 is the answer. Now cellulose is the most abundant polysaccharide, and in the diet it acts as the fiber. Now there are two kinds of fiber. The insoluble fibers are the one that are excreted as it is, that are excreted unchanged. And such examples are cellulose and hemicellulose. Soluble fibers are the one that absorbs the water and they are converted to gel form. So in case of if a person is having constipation, that is very hard stool, it absorbs water from intestine, it makes the stool as the gel form, and it can easily pass, the person can easily pass the stool, and that is why the soluble fibers are used in case of treating the constipation. Examples of soluble fibers are pectins, gum, and inulin. Inulin is again a type of a homopolysaccharide and it is made up of beta fructose. Now if you remember cellulose, it is beta glucose. Beta fructose, again beta bond are the one that are not easily broken. The enzymes in the body are not present to break the beta bond, and therefore inulin also is not broken in the body. That is because of the beta anomerism that is present at C2. So fructose is a keto. It is a ketone functional group which is present at C2. So inulin is not broken because of the beta anomerism that is present at the C2, because it is a ketone group, and the ketone group is present at the C2. So inulin is ideal for measuring the GFR because it is neither secreted nor excreted from the kidneys, and along with the probiotics it is used as prebiotics, that is food for the bacteria. Another homopolysaccharide is chitin, which is the second most abundant natural polysaccharide. It is unbranched and it is made up of N-acetyl glucosamine, and it is found in the exoskeleton of a cockroach, of insects or fungi. Now the carbohydrate group contains CH and O, fats contain again CH and O, and amino acid contain amine group, that is NH2 or N. Coming to heteropolysaccharide are glycosamine glycan. So they are also known as mucopolysaccharides. Why mucopolysaccharides? Because they are present in the mucus secretions. That is, they act as the lubricant because it contains negative charges. Now negative charges such as sulfates, negative charges such as carboxy group, negative charges such as acetyl group. See, these all negative charges, they repel each other and therefore they make it slimy and slippery, and that is why they are present in the mucus secretion, and that is why they are also known as mucopolysaccharides, because they are polysaccharide and they are mucus in nature. That is why mucopolysaccharides. So glycosamine glycans, these are mucopolysaccharides. So glycosamine glycan, I already told you, made up of repeated units of amino sugar and uronic acid. So if you reduce a monosaccharide, it forms the uronic acid. So basically reduction of a monosaccharide, oxidation of a monosaccharide causes acid, and reduction of a monosaccharide causes alcohol. So this is oxidation, not reduction, it is oxidation. Basically a glycosamine glycan is a repeated unit of amino sugar and uronic acid. So it is tandem repeats, that means repeated one after another. Glycosamine glycan, it forms a covalent bond with a protein and forms the proteoglycan. So remember, the word that is in the end is more. So in proteoglycan, glycans are more, and in glycoprotein, proteins are more. So in proteoglycan, carbs, that is glycans, are more than the proteins, and in glycoproteins, proteins are more than the carbs. So proteoglycans, the example wherein the carbohydrate is more is glycosamine glycan. And in case if protein is more, example is collagen. So in case of glycosamine glycan, wherein the carbohydrate is more, the carbohydrate is heteropolysaccharide. It is linear and unbranched. While on the other hand, glycoprotein, wherein protein is more, example is collagen. So all plasma protein except the albumin is the only protein. Carbohydrate, in case of glycoprotein, which is less, it is either monosaccharide or oligosaccharide. Basically short and branched carbohydrate is present. Carbohydrate is never polysaccharide in case of glycoprotein, wherein the carbohydrate is already less. Now if you see glycosamine glycans, they are mostly sulfated. So the examples for heteropolysaccharide or glycosamine glycans, they end in word sulfate, such as heparin sulfate or chondroitin sulfate or dermatin sulfate. So all the sulfates, so they are mostly sulfated except hyaluronic acid. Hyaluronic acid ends with the acid, therefore it is the only glycosamine glycan which is not sulfated. It is the longest glycosamine glycan and it is located in the synovial fluid of the joint and vitreous humor of the eye. It has got a role in wound healing and cell migration. Now coming to chondroitin sulfate, which is present in cartilage, bone and tendons. Dermatin sulfate is found in the skin, blood vessels and walls of the heart. Keratin sulfate is the most heterogeneous glycosamine glycan, and keratin sulfate is the only glycosamine glycan which does not contain uronic acid. Now glycosamine glycan are made up of units of uronic acid and amino sugar. Uronic acid and amino sugar, and the such repeated units are known as glycosamine glycan. In case of keratin sulfate, uronic acid is not present. So keratin sulfate is present in the cornea and the connective tissue, and it is responsible for transparency of the cornea. So they can ask you what is responsible for the transparency of the cornea, which heteropolysaccharide or which glycosamine glycan. It is keratin sulfate. Heparin does not contain sulfate, but it is the most sulfated because it contains highest negative charge among the glycosamine glycan, and that is why it is anticoagulant. It activates the antithrombin 3 and it slows or prevent the progression of DVT. Basically it slows down further clot formation. So it is released from the mast cell and the liver, and it is the expensive anticoagulant. Heparin sulfate is present on the cell surfaces and it has a role in retinal cell-cell attachment.